about basic laparoscopy and how to start off a laparoscopy surgical procedure. ಉದರ ದರ್ಶಕ ಅರೆ ಇದೇನಪ್ಪ ಕನ್ನಡದಲ್ಲಿ ಮಾತಾಡ್ತಿದ್ದಾರೆ. ಉದರ ದರ್ಶಕ ಅಂದ್ರೆ ಕನ್ನಡದಲ್ಲಿ ಲ್ಯಾಪರೋಸ್ಕೋಪಿ ಮೀನ್ಸ್ ಲ್ಯಾಪರೋಸ್ಕೋಪಿ ಇನ್ ಕನ್ನಡ. Laparoscopic procedures are done both as an elective and as an emergency at both of our teaching and MH hospitals. It has always been my proud privilege to associate with AMASI. AMASI stands for Association of Minimal Access Surgeons of India. The founder, chairman and president being Dr. Palnivelu from Coimbatore, Tamil Nadu. He is also the president and chairman of the GEM hospitals in Chennai and Coimbatore. In the year 2019, February, we associated, our Department of General Surgery had associated with AMASI, and we conducted a skill course and a fellowship exam for 3 days. AMASI, interestingly, is also a subsection of Association of Surgeons of India, our parent body of surgeons. Now we shall proceed to invite the dignitaries onto the dais. I shall invite our principal and dean, Dr. Shalini Madam. I shall invite our Dr. Pratap. Sir, thanks for coming. And also thanks for being critical in evaluating our brochure. We shall seek your ideas for our future endeavors. Dr. Rudresh, please come on to the dais, sir. He is our Department of Surgery. Sir, without your guidance and straightforward inputs, we could have conducted this day. Please welcome, sir. Dr. Sopil Mat, he is our representative from AMASI. He is from Hubli. He is a laparoscopic surgeon. And Amit Werner, please welcome to the next, sir. Dr. Srivatsa, please come on to the dais. Dr. Bharti, please, ma'am. We'll move on to the inaugural ceremony. Implementing a few simple changes for a more sustainable green workplace. We will be inaugurating this workshop and CME by watering the plant. Okay, right. Please stand up for the Ramaiah anthem. Thank you. Start off with the watering the plant, the green shape. Thank you. Madam Principal, can you say a few words?
You all a very pleasant morning. It's nice to see so many young faces early in the morning, and we're very happy to have you all here. I thank the Department of General Surgery for organizing this workshop, and I thank our external speaker for having come on the way here to Bangalore. I know it is a second visit, he told me, but we hope you enjoyed this visit as much as you did the last one. Actually, minimal access surgery was very in its very infancy when I was studying about 40 years ago. When I was doing MBBS, it was very nobody actually knew much about it, and now it has become so common, and it has been done in so many various types of surgeries. And I heard that it is really helpful to the patient in terms of duration of hospitalization, cost, reduction in pain and morbidity. So I think this is going to be a really useful workshop for people who are especially budding surgeons and surgeons who have just cleared their exams, young surgeons. It's going to be a really useful workshop, and I hope you make much use of this workshop. So wishing you all the very best. Thank you.
After few words.
Very good morning to one and all. There are areas which we talk in terms of upgradation with respect to skill. And I'm sure that at this early phase, some of our interns, I find them sitting here, so you'll be exposed to the theory component and how at least it is going to be done. You can watch. Then you have postgraduates at this stage of your career, you're still going to be exposed to these procedures, workshops. So you will again have an exposure at an early stage. And whenever we talk in terms of any subject or with related to any organization of any program that is meant for continuous medical education, we think in terms of three aspects. One, education. So it is going to be educating not only for the beginners, but as was elaborated earlier, we are always learners and we will always end up being learners. There is no day that we can claim that we know everything. Suppose we do that, then that is stop of progress. So that is with respect to your educational objective. Then with respect to passing on what you have learned in terms of improving your patient outcomes is something that you'll have to correlate with and see how this education or this workshop is going to translate into better patient outcomes. And third thing, we have a state-of-art advanced learning center. So there is provision for you to think in terms of doing research, and you have a very good cadaver lab here. So that is another thing that you can think in terms of translating it into. And I'm very happy that the Department of Surgery has gone for collaboration with Amasi. Similar collaborations are necessary. If necessary, you may have to go far more and think in terms of collaborating internationally to see what best you can bring to your students, including your undergraduates, postgraduates, and faculty, and see how fruitful you could make it for overall well-being. So wishing all the best to all the participants and to the organizers. I take leave saying that please see that when these opportunities come your way, make maximum use of it. Thank you.
We have our external faculty from Hubli, Dr. Sopin Mati. Would you mind say a few words, sir?
Thank you all for making me part of this program. Madam Shall, Professor Prabhakar. Sorry, please pardon me. No, it is a very sensitive thing when somebody mispronounces it, so I sincerely apologize for that. And Professor Rudresh, hope I'm correct, I won't do any mistakes, and Madam Bharti, and Shekhar Daya, and Pai, Nitin, Vignesh, Professor Srivastava, our good old friends, and Gautam, who are speakers in Hubli. So, I must say that it's a nice opportunity, and I'm happy to meet you all again. As Madam said, I think 30-40 years ago, we were not so lucky as you are all today. We had a tough time in learning all these newer things. Of course, they came a little later. And our seminar halls were very basic, where we used to present the cases and do the beyond letter of knowledge. We have such a nice ambience, such a nice setup. And I love that handle. I also request Madam to give us some tips. I learned that she's 1 year senior to me. How to retain our few hair, whatever is left with us. And many of the administrators then whom you have seen rarely smile. So I must thank you for that pleasant personality and what she is carrying around. As you all know, that Amasi was set up in 2003. And the founder president, nothing has developed without pains anywhere in the world. Even Professor Palnivelu literally carried his instrument to the government hospital to do surgery because the hospital wouldn't buy the instruments. He used to carry his own instruments. He was so passionate to teach people that they should pick it up because there was skepticism, as you all know. Then you're all comfortable now, laparoscopy we talk about. Now, those days it was a word which should be avoided, like, it was like a taboo if somebody says I do laparoscopy, like that was the era then. So it took a lot of effort to popularize it, and that's how the Amasi was founded in 2003. From that time onwards, it's been growing by leaps and bounds because people are embracing this technology. It's beneficial, definitely. Of course, some techniques are still evolving, but it's proved its mettle in most of the procedures and has established as a gold standard itself. What started as a humble beginning in 2003, now the membership has crossed more than 12,000. And it's one of the biggest minimal access surgery association in the world. And even in India, it's one of the most admired association because it has been spreading knowledge, educating youngsters, teaching by way of skill courses, examination fellowship exams, and now there are diplomas programs which are conducted by Amasi. And there has been a serious effort to have a license with the university and make it MCA recognized program so that it will have some standing from other front too. So that's how it has been growing and growing and growing. And it conducts a lot of programs like the zonal programs, CMEs like this, and it's always happy to get associated with anybody who wants to do a program in the access surgery. So I must compliment the Ramaiah teams, the surgery team, who have been taking it forward and doing a lot of activities. And but for COVID, these 2 years, I think now it's restarted again. That few words I would not like to say much. And I thank you all. Hope the program goes on very well. And with all the support what you are getting, I'm sure this institute should see a cadaveric workshop soon. And I'm sure with this enthusiastic team and the support from all the people, and it's going to be a unique program and very well appreciated in minimal access surgery. I'm sure about it. So please do take it up and see that it comes out faster. Thank you all. Thank you.
Thank you, sir, for your kind words. Now we will be moving on to the teaching hospital, the second floor, next to the OT, where we have lectures about basic laparoscopy, how to set up a laparoscopy unit, energy sources in laparoscopy, how to handle a laparoscopy instruments, what are possible complications of laparoscopy. And yes, we have 2 cases, live workshop, basic surgical procedures, gallbladder and appendix, which are done day in and day out. So we'll be demonstrating that, and there'll be discussions, and we shall move on there. Thank you, Paul.
Has reduced. Okay. Very important is some knowledge of the energy sources is absolute prerequisite. So we use it just like that, but we should have the background knowledge of what it is. So very important is avoiding mishaps from this.
If I can use the, excuse my French, pain in the ass. So what will happen is if it goes in the wrong space, in your first insertion itself, what will happen? The gas will insufflate the pre-petal.
Yes, and you've gone beyond 2 feet.
2 feet. So this is how you can go almost up to GJ with the same technique. See, the bowel has to follow the technique.